Nigeria records more cases of coronavirus as more patients are fully recovered and discharged. Presidential Task Force on COVID-19 urged state government on better welfare and security of COVID-19 patients. Plus, more state governments embrace TV, radio and online learning for students. These and more on Panorama today with me, Habiba Oladipo. The Supreme Court has set aside the judicial processes that led to the conviction of the former Abia State Governor Ojiuzo Kalu for corruption. In a unanimous judgment, the Apex Court held that the conviction was inconsistent with the Constitution. In her judgment, the presiding Justice Amina Adamu Agui, said the President Court of Appeal erred in law when she granted leave for Justice Mohammed Idris to return to the Federal High Court Lagos and conclude Ojiuzo Kalu's corruption trial. The Apex Court subsequently directed the Chief Judge, Federal High Court, to reassign the case to another judge for a fresh trial. The appeal was filed by Ude Jones Udeugu, a former finance director, Abia State Government House, challenging his conviction and imprisonment along with the ex-governor Ojiuzo Kalu. They were both found guilty of 7.1 billion naira fraud. An update of COVID-19, the Nigerian Center for Disease Control, NCDC, has announced 381 new cases of COVID-19 in the country. A breakdown shows that there are 183 cases in Lagos, Kano 55, Jigawa 44, Zamfara and Bauchi 19 each, Katsina 11, Borno 9, Kwara 8, Kaduna 7, Gombe 6, Ogun 5, Sokoto has 4. Others are Oyo and Rivers State, 3 each, Niger 2, Akwa Ibom, Enugu and Plateau State 1 each. As at 7th of May, there are 3,526 confirmed cases of COVID-19, 601 discharged patients and 107 deaths. And state governments have been urged to take the welfare and security of COVID-19 patients seriously in order to avoid the cases of escape and restiveness. Chairman of the task force and secretary to the government of the Federation, Boss Mustafa, said this at a daily briefing in Abuja. Miltaire Ikben reports.
Of basic guidelines to contain the spread of coronavirus among Nigerians remain on the front burner.
Increasing level of appeals of exemption granted to vehicles conveying specific goods. Reports across the country show that they continue to hide passengers with the intention of ferrying them across state boundaries. Continual transportation of the Almajiris across state borders is still evident. We implore all Nigerians to alert the security agencies whenever they witness the violation of these guidelines.
Every business should invest a little bit in hand-washing facilities and sanitizers.
With recent reports of protests in some isolation camps, the PTF called for greater vigilance.
We urge all state governments to continue to pay attention to the welfare of people in isolation and for security agencies to provide adequate security around such facilities to prevent escape.
On the 14-day compulsory isolation for the first batch of Nigerian returnees in the country, the Minister of Health says
they will be tested, and any person tested positive shall be transferred to a treatment center.
We are hoping to have another flight coming in from the UK. They'll be landing in Lagos first, that's the plan, and then we'll be ferried to Abuja.
The task force frowned at reports of continued harassment and denial of access to journalists as essential workers during curfew hours.
The issue of harassment of journalists, yes, we are having a meeting of the security chiefs tomorrow. I have already reached out to the IG and I'll try and see if we can get him so that before the meeting he's aware of the issues and he'll be able to intervene.
I promised that I was going to contact the Lagos State Commissioner of Police. I took up the issue of the harassment with him. He recognizes the fact that journalists are on essential duties and that every support will be given to them in the course of their duties.
Meanwhile, the Federal Ministry of Health has stepped up training of health workers in the country to stem the risk of infection among medical personnel caring for coronavirus patients. In Abuja, Mitaire Ikben, NTA News.
And the Kogi State government has directed that the NCDC COVID-19 response team currently in the state to assist and verify its COVID-19 free status be isolated at the state quarantine center for 14 days in line with the laid-down procedure. Governor Yaya Bello gave the directive while playing host to the NCDC members shortly after their arrival in Lokoja. Details of that report will be brought to you in our subsequent bulletin. In the meantime, let's join Caleb in our Just Network Center for more on Panorama.
Thank you very much and welcome to JOS. The Plateau State Commissioner for Health, Dr. Nimkom Damlar, says the 4 confirmed cases in isolation are stable and in good condition, as the index case is set for discharge soon after testing negative twice. The Commissioner gave the update while briefing newsmen at the old Government House Rayfield. Ashezi Gopep reports.
The state surveillance team, the commissioner said, has intensified contact tracing to investigate further and institute other public health measures to curb the spread of the disease in the state.
So far, we confirmed cases 4. The first index, and we the one that follows, they are doing well. The case that we identified yesterday has been taken to the isolation center to treatment. So all of them are doing well. Distribution of cases by local government. So far, just not as 1. 2 came from one town. Then the other one was also from the same which town from the
He implored the citizens to be vigilant and report any suspicious case while assisting the government to enforce the border closure directive.
This is the first time we are having somebody from the community, so we are likely going to have community transmission. This particular person is 45-year-old.
Secretary to the government of the state, Professor Danladi Atu, who commended citizens for cooperating with government's lockdown directive, assures government's readiness in fighting the disease.
All the essential duties around the state borders at 6 p.m. and to restart overnight till 7 a.m. following day. The reason that the government has noticed that some people hide under that canopy and then they intrude into the state. It is expected that even where you are on essential services, you need to be checked. Data capture of all persons and vehicles on essential services entering or passing through Plateau State are essential. We hence will be mandatory upon presentation of acceptable identification.
Residents are therefore advised not to panic, but to continue to imbibe good personal and respiratory hygiene, maintain social distancing, as well as avoid crowded places, as government on its part is not leaving anything to chance to combat the dreaded disease. In Jos, Ashezi Gopep, NTA News.
Residents of Jos have applauded efforts of security operatives manning checkpoints in the metropolis for enforcing compulsory use of face mask in the state. Elisabetu Kai Andrew has a situation report.
A drive round the metropolis shows the level of compliance to the lockdown directives by the state government is encouraging. The few vehicular movements seen were that of essential service providers out on essential duties. Residents say the enforcement by the security operatives on face masks has enhanced the usage. However, they urge health practitioners to enlighten residents on the proper usage of the masks.
Yeah, most of them are complying. Almost everywhere we go with water to supply for residents who doesn't have water in their premises. Most of them, I see them wearing their face masks. Many people are putting on their face masks, which actually they have obeyed the rules and regulation of the state government to stay healthy.
The securities are really doing a good job. Even some organizations, both private and government, enforcement, they work to see that you must have your face masks. Where you don't have, you cannot access their organization or their facility.
Security operatives who spoke off camera said defaulters of the lockdown rule were being held for an hour or sent back home. Some organizations providing essential services were not left out in complying with the directives on the use of face masks. In Jos, Alisa Batukai Andrew, NTA News.
It is now obvious that Nigeria is presently grappling with the challenges of community transmission as evident in many states. How do we go about this and the way forward? I have in the studio the Chief Medical Director of Plateau Specialist Hospital, Dr. Philemon Golwa, to give some insight on possible ways to arrest the spread. Doctor, welcome to Panorama.
Thank you very much.
Okay, so CMD, sir. The spread is already in some communities of Nigeria. What gave rise to this?
Well, I think for us to really understand the concept of community spread of the coronavirus, we really need to have a small definition of what it is. The community spread of the virus is more or less like the virus is ongoing within a community, but the person that is involved does not even have a contact with any person that is confirmed, or he has not gone outside his state or outside the country for any event. So in other words, you have an ongoing process of community infection without really tracing it down or pinning down one person. So that makes the problem a little bit much more complicated. And so that is the scenario that we have in the community. But what we have to say here is that if you really don't go out to find out what is happening, it will be very difficult to really come down to pin down what it is. The situation right now is, we are saying that people should really adhere strictly to what government has put in place, and the teaching is ongoing. We are spreading all around the communities to tell them these basic basic pathways for government that has put in place must be really adhered to. For example, changing from washing your hand every day before and after an event is something that we really need to get adopted to. So these basic principles of trying to prevent COVID-19 is the method that we need to really make it our lifetime habit every day. And that way we'll be able to have some good level of control of the community infection.
All right, I think that has been emphasized severally, yes. And government has put in place, measures to ward off this community spread. But yet we still get this virus going. So, from what you are saying, how do we ward this off? Are you saying it's going to be difficult?
Well, it's a very big Herculean task, but it is possible if there's good teaching with understanding why people really need to follow these basic procedures. One of the major problems that we've found is that people take it for granted. They are not really interested. They just think of their businesses, they're thinking of what we're going to eat. But you need to survive before you even eat. The issue of eating is something that can come much later if you really survive. So we're stressing the fact that community spread of the infection must really be curbed. And the only way is for us to follow the basic laid-down procedures for curbing the infection. And I believe that with intensive teaching and advocacy and going right down to the communities, we'll be able to get over it. And I think that's the best way to go.
Okay. Plateau is also involved in the issue of lockdown. What's your assessment generally?
Well, I think it's been pretty good. In fact, if you listen carefully, for those who are infiltrating or struggling to come to Plateau, they will tell you that they have gone around many states, but Plateau State is one of the most difficult to penetrate. But even though in this case or the other cases that we have now, as a new case today, it just came from one with Almajiris, and that goes to tell you that at the borders we are reinforcing very strictly, and we believe that if you follow these laid-down procedures with our principles, we're able to circumvent the problem.
But I'm sure you'll have some final words, some advice.
Yes, my advice is very simple. As far as I'm concerned, these basic rules, we have found out that lockdown has really curbed the infection. Face masks, washing of hands, sanitizers, and rather even within a hospital, for example, we have emphasized that nobody should come in to even access services without the face mask. So, and I see that a very great level of compliance is really being enforced, and I believe that we're on the right track.
Doctor, before you go, I'm sure you will need to comment on this issue of exercise in the morning, and young people, you see them gather in fields, doing exercises, and you see them in groups. I'm sure that has been discouraged, right?
Yeah, it's been discouraged because you are not really following the social distancing. And of course, you cannot play a game or have an event without touching one another. That's what we're struggling to discourage people. And I believe that the best way is to sit down at home. These exercises can be done as indoor within your house without really going out to have it on the field.
Okay. What can parents do?
Parents should really follow suit without going out to go in a massive environment where people are really gathered together in a large number. We advise parents that have money to be able to buy indoor games, that be able to play within their houses rather than going out in a big field.
Okay. Nigerians are eager to know what health personnel are doing, especially there are states, I'm sure there are 2 states now that don't have the virus.
Yes.
Okay, so what do you think they did different that they are still, without any case?
Well, I think one of the major things is adherence to the government laws. If people adhere to government laws, they will be able to get over it. And then contact tracing mechanisms. Some states, for example, Kogi, and he has got some software as well. You can really do contact tracing. Okay. So I think that way they were able to circumvent, or they don't really have incidence cases.
Okay, thank you very much, Doctor. I've been speaking with the CMD Plateau Specialist Hospital, Dr. Philemon Golwa. We'll take a break, and Panorama will continue shortly.
I wish to once again commend the frontline workers across the country who, on a daily basis, risk everything to ensure we win this fight. For those who got infected in the line of duty, rest assured that government will do all it takes to support you and your families during this exceedingly difficult period. I will also take this opportunity to assure you all that your safety, well-being, and welfare remains paramount to our government. I am using this opportunity to express our deepest condolences to the families of all Nigerians that have lost their loved ones as a result of the COVID-19 pandemic. This is our collective loss, and we share your grief.
Welcome back. This is Panorama from NTA Network Center, Jos. The United Nations Women have donated over 38 million naira to the Federal Ministry of Women Affairs as support to Nigerian women who are worst hit by the effects of the lockdown. Nonso Damien Ati captured the presentation at the Ministry of Women Affairs headquarters in Abuja.
The Ministry of Women Affairs in its gates after the long compulsory lockdown. And the first callers to the ministry are the United Nations women.
No longer in the shadow, cause to stay behind.
Open gates later led to wide smiles as they did not come empty-handed, but with some monetary support for Nigerian women was hit by the effects of the lockdown.
Frontline services in Lagos, for example, have reported a 300% increase in gender-based violence cases from March to April. So in view of some of these challenges being faced by women, hope that the support will meet the immediate needs of up to 12,600 vulnerable women and girls.
The Minister of Women Affairs, Port and Talent, is appreciative of the gesture, promising equitable distribution among women across the 36 states.
Continue to appreciate and work together to see that Nigerian women are well cared for. These palliatives and whatever we're reaching out to, the poorest of the poor, those who live on daily business to earn their living.
38,453,660 naira is the support received. In Abuja, Momso Damien Ati, NTA News. NTA News.
More palliatives continue to reach the poor and the vulnerable groups in Plateau State. Chairman of the Palliative Committee and the Deputy Governor of the state, Professor Sonny Choden, has urged citizens to be tolerant and patient as more people would be reached in coming days. It was while presenting some relief materials to 5 local government areas in the Plateau Central Zone. Abdul Wahab Babankanti reports.
The Deputy Governor reiterated government commitment in cushioning the hardship faced by the people during the pandemic. The palliatives are for immediate distribution, as the committee hopes that the material will be distributed within the span of 72 hours.
Spread it out to all the relevant wards, and then the wards should use at least 2 days to distribute it to all polling units. I said all polling units, no exception. And in the polling units, they have to choose 5 needy households. 5, one of which should be a widow. But the government is doing its best, both from the national, state and local government, to see that the pains are minimized as much as possible.
With this flock of Pangshin, Kanke, Kanam, Bokos, and Mongoluko government areas are expected to pick up palliatives for onward distribution to the targeted persons in their areas. From Bokos, Abdulwahab Babankanti, NTA News.
The federal government has deployed a technical committee to facilitate the movement of foodstuff and other agricultural produce amid the interstate boundary movement restriction order. The committee in Sokoto is headed by the State Commissioner of Police, Ibrahim Sani Kaoje. Abdurrahman Usman Jibrin reports.
The committee was put in place to ensure compliance with measures put in place by government on interstate movement restriction and ensure free movement of agricultural products, especially foodstuffs, in line with NCDC guidelines. The technical committee headed by Sokoto State Police Commissioner supervised the Sokoto-Zamfara state boundary to ensure compliance with the directives.
In order to have an easy passage of agricultural products and foodstuffs. So that's why this committee is inaugurated. The drivers of the vehicle that are passed also need to be screened. They do temperature screening them before passing.
The interstate movement restriction and the free movement of agricultural produce is worsened by the activities of dubious people, which necessitated the Federal Ministry of Agriculture and Rural Development to come up with the committee to tackle possible challenges.
What we are emphasizing on is that we don't allow any of this truck to come with any passenger because they are not allowed to move with anybody.
Meanwhile, the Independent National Electoral Commission in Sokoto has supported the Sokoto State government with 20 vehicles to be used in the fight against COVID-19 in the state. The vehicles are to be used in conveying, logistics, and other services. In Sokoto, Abraham Sponjibrila, NTA News.
128 Almajiri children have been conveyed to their state of origin, Bauchi, for profiling and ascertaining their health status on COVID-19 for onward integration with their families and society. Chairman, Plateau State Committee on Profiling, Ban and Evacuation of Almajiri, Colonel Salisu Inusa, retired, disclosed at the transit camp in Jos. Kim Gotts reports.
The 128 Almajiris of Bauchi State origin, whose ages fall between 6 to 15 years, were intercepted in Yelwa Shandam of Shandam local government area in a truck by security operatives on their way to Bauchi for violating the lockdown directive by government against the backdrop of the COVID-19 pandemic. Chairman, Plateau State Committee on Profiling, Ban and Evacuation of Almajiris, Colonel Salisu Inusa, retired, while speaking on the development, noted that the committee has equally received 99 Almajiris of Plateau State origin from Nasarawa State undergoing necessary COVID-19 tests before reuniting them with their families.
And we have that of Plateau too, because we have to segregate them because of the social distance, and we have to do health check for them to determine their status before we now send them to their various states.
Another set of 12 Almajiris of Plateau origin who tried to sneak into the state from Nasarawa State are currently at the transit camp in Jos for appropriate screening, the committee added. In Jos, Kim Goetz, NTA News.
And that's it on Panorama from NTA Network Center, Jos. Please, let's stay safe. Good day.